Thank you, Bono. Honorable Minister of Public Service and Labor, Honorable Minister of Health, Deputy CEO of RBC, SG Sestrar, and Chief Advocacy of PSF, distinguished guests, thank you for joining us this afternoon, or throughout this morning, for this very important event. As we gather here today to exchange on how to improve the safety and health of our employees, I start by extending my sincere appreciation. It all starts by showing up, and as many we had invited, you being here today is of a great significance. It speaks more when you show up, because then everything else can follow. Work is essential to people's lives, to the stability of families and societies. It is key to poverty reduction and to achievement of social inclusion and social cohesion. Such work must be of acceptable quality. In our lifetime, workers are exposed to some contingencies such as employment injury, old age, sickness, invalidity, and death. Excuse me. For many years, the government of Rwanda has established social security programs to ensure against such risks. And RSSB is the administrator of such social security programs, and currently we're managing six social security schemes. I hope everyone here is on at least 5 of them. Those being pension and occupational hazard, maternity leave, Ejoheza, community health benefits, and Rama. So again, I hope if you're not in Rama or Mutuel, I hope you have hopefully another private one, but you must be at least insured by 5 of those. Occupational hazard is a scheme that not only assists employees in the occurrence of work-related illness or accidents, but also, and most importantly, collaborates with other concerned institutions to implement occupational incidents prevention activities, such as today's events, inspections, and many more. As mentioned by preceding speakers, and thanks for the panelists who just finished, gave us good example, practical words and ways to be more compliant. We are gathered here to reflect on our role and responsibilities towards preventing work-related illness and accidents. Research has revealed that a conducive work environment can lead to many long-term health conditions. The most prevalent conditions linked to the working environment and lifestyles are related to non-communicable diseases. We've seen the numbers, and from what they just read us, I wanted to hear, so the blue and red, but maybe we didn't get a good clarification. Are we good? Are we in a way? But if I can go from what I interpreted from it, there were more blues than oranges. So I can hint that we are okay, but we still have a way to go. This affects not only employees and their families, but also the enterprise productivities and overall country's economy. In 2021, WHO and ILO joint reports on work-related burden and diseases, it was estimated that every year about 2 million people die from exposure to risk factors in the workplace. In our records at RSSB, we have seen a 14% year-on-year increase in occupational disease and accidents in the last 4 years. Despite the well-known underreporting of such cases, we understand that now more and more there is an urgent call for action to provide a conducive working environment to our employees. If you compare what we have seen, if we are doubling the number of reports again, considering the underreporting, one can assess that, are the numbers increasing or are we reporting better? Either way, it shows that we still have a way to bigger room to improve. And on the spending side, as you've seen some of the slides shown this morning, we've more than doubled for the past 5 years. Again, these are resources that can be reinvested in elsewhere, but as of today, we continue to collaborate to make sure that it's invested in creating more. It's cheaper to prevent than to cure, as hopefully the Minister of Health and other stakeholders have emphasized and will be emphasized later. As employers, we have the power to influence behavior change in our workplace and the obligation to provide a safer working environment. Your commitment and participation are key to success of the wellness program that was discussed today. This session, therefore, offers an opportunity to make more strides in creating conducive environment, and RSSB commits to support the capacity building that will enable the implementation of such workplace wellness programs. Awareness and healthy lifestyle and early detection of health conditions are proven to be some of the cost-effective interventions in keeping people healthy and productive. However, the turn-up to health facilities for checkups remain very low among eligible performers. We've seen it again in the presentations this morning of how, despite the available facilities and opportunities, the low level of attendance, whether going to the gym or even taking advantage of such opportunities to get checked. And there's one of the presenters who used an example of cars. We drove cars here, or at least came into one. And we all take time to make sure we do the mandatory required checkups. But how many of us think through that? I thought that was very practical example to relate to. So following that, I'm happy to announce that RSSB, through its corporate social responsibility budget to reduce the burden on our members, we are committed to make a humble financial contribution to the NCD screening and education program targeting employees at their workplace, in collaboration with the Ministry of Health, RBC, and Ministry of Public Service and Labor, and other partners. My call to action is for everyone, to all the employers here present, to make sure that employees participate actively to this program. And also we count availing resources is one thing, but your advocacy is irreplaceable. And we hope, as we look at the results by the end of this year, once we start this program, we can see the realized effect being more participation in the checkups, exercising, awareness, but also a reduced number of cases and improved health status of the employees. Together with the firm commitment, we can achieve more. Therefore, I look forward to more collaboration and to a healthier, more productive workforce. Thank you all. I appreciate your kind attention and your participation.